Welcome to the Society for Public Health Education annual virtual conference. My name is Lauren Machete, and I will be the moderator for this session. Today's session is titled CDC Environmental Health, and our presenters are Holly Wilson and Ann Ussery Hall. For today's program, I would like to introduce to you Holly Wilson, who has been with the CDC for over 20 years, designing, implementing, and evaluating training products and communication messages for a variety of audiences. Currently, she is the lead communicator for the CDC's Environmental Public Health Tracking Program. Her professional interests include data visualization, health literacy, and storytelling. She's a Bachelor and Master of Science in Health Science Education from the University of Florida, Go Gators, and is a Master Certified Health Education Specialist. Ann Ussery Hall is a public health advisor at the Centers for Disease Control and Prevention's National Environmental Public Health Tracking Program. She has over 20 years experience conducting program evaluation and performance monitoring for various local and national public health initiatives. She received her Master of Public Health in Health Education and Behavior from the University of Alabama at Birmingham. Without further ado, I'll hand it off to our presenters.
Thank you to everyone who has joined us today. This is Ann Ussery Hall, and we are really excited to talk with you all about CDC's Environmental Public Health Tracking Network. It's where Holly and I both work, and we're always excited for opportunities to share the network. We're really proud of it. So today we really want to show you, oh yeah, there we are, greetings from Atlanta. Today we wanted to show you the tracking network, which is a web-based data system that is available to anyone. So we're really hoping that by the end of this presentation or when it's over, you all will take a look. We want to show you today how the types of data that are shared there on the tracking network are available through the Data Explorer, how you get to it and how you can use it. We'll show you how you can look up information by location on the tracking network. And we want to demonstrate how you can personalize your own data visualization using tracking's free environmental health data for your own projects, interest, or explorations, anything you want to do. So by the end of our presentation, we think you will be able to perform a query on the Data Explorer and customize the data display however you'd like it, and describe the utility of the tracking network data for health education practice. But first, I want to give you a little bit of background about tracking. So in 2000, the Pew Environmental Health Commission released a report that detailed an environmental health gap, a lack of basic information needed to document links between environmental hazards and chronic disease. This report described how this knowledge gap was hindering efforts to reduce or eliminate diseases that may be prevented by managing environmental factors. Some of the causes of the knowledge gap were that environmental hazard data were collected for regulatory purposes only and not for public health use. There was insufficient data on human exposures to environmental hazards. Where data did exist at the state and local levels, there was no standardized or synchronized national data collection process. The data were often never analyzed or interpreted to inform action, and there were typically the data were never released to the public. So in 2002, Congress appropriated funds to CDC to establish the Environmental Public Health Tracking Program. Through this program, CDC funds state and city health departments to build local tracking networks. And then these state and local data systems feed into the national tracking network, which is the web-based data system hosted by CDC that we're sharing with you today. Go ahead. So this visual, I think, really highlights the different types of data that are collected and shared in the tracking network. You can see that it begins on the left with environmental hazards, goes through the exposures to those environmental hazards, continues on then on the right to the health effects potentially related to those exposures, and then also includes any population characteristics that are available. You can see listed here then, I'm sorry, go back, in those drop down are those bulleted lists. Those are the various content areas or categories that are included within the network. Each of the content areas has numerous indicators or measures. For example, if you look at the first, under the environmental area, all the way to the left, the first content area there under environmental is air quality. So for that content area, the measures include things like the number of days above regulatory standard ozone levels, numbers of wildfires locally, air toxins, that type of thing. And our Data Explorer currently contains 471 of those measures. We always perform continuous quality improvement and update the list of indicators as needed. On the next slide, we see the important members of the tracking program. There are lots of them. We have 26 state and 1 local health department. You can see those all highlighted on the map. The one city is New York City. Those recipients collect environmental health data in their communities. They develop local tracking networks for their own health departments, and then they also share those data with CDC. Another important member of the tracking program is the Association of State and Territorial Health Officials, or ASTO, that you can see listed there in the yellowish box. They do this wonderful program of fellowships with us, with the tracking program, and they really help us to build the capacity of the non-funded health agencies. You can see around the map, again, all of those, the different shapes and the triangles represent where the different fellowships have been, which is great because while we would love to fund everyone, of course, at this point, that's not an option. So this way we can really stretch our reach. This program provides opportunities for fellows to develop and implement a pilot project to advance environmental public health in their own areas, to receive guidance from CDC grantee mentors, and to become familiar with CDC standards and resources for environmental public health tracking. Now, CDC also partners with numerous other federal agencies and national organizations for tracking. For example, we collaborate with the EPA and NASA for scientific research of the health effects of environmental hazards. We also fund other partners to reach specific user groups, to address environmental health disparities, and to share data and knowledge to improve public health. Those partners include, but are not limited to, the National Association of Chronic Disease Directors and the National Association of County and City Health Officials. We have so many partners, we certainly can't list them all here, but please visit our website and you can learn much more about these partners and what they do with tracking. On the next slide, you can see how we like to look at what is done with tracking data. We always tell people that the goal of tracking is not just to house data, but to increase the number of data-driven environmental public health actions and decisions that ultimately improve health. So this slide highlights different types of actions that we see. This is just an example. There are many, many more, but we just wanted to highlight these different types. I also want to share just a few examples from our recipients. And again, if we had hours, I could share many more, but I hope that you visit our website and read up on so many of the great actions that our grantees have done, or our recipients have done. So for example, I wanted to highlight one from New Jersey, where nearly 6 million residents live in moderate to high risk areas for cancer-causing radon in their homes. There's no mandatory requirement in New Jersey for radon testing, and therefore we saw that between 1996 and 2015, only about 30% of homes had ever been tested for radon. As a result, the New Jersey tracking program worked with partners to conduct an awareness campaign and promote radon testing and mitigation in over 500 cities in New Jersey. They sent informational mailings, posted a variety of social media messaging, produced and shared a podcast, and participated in a radio interview. All of this to help increase awareness about the importance of testing homes for radon. In addition, they gained the support of the governor, who issued a proclamation encouraging testing homes for radon. Due to this outreach campaign, the New Jersey tracking program saw an increase in their webpage usage, social media interactions, and phone calls to the program about radon. Most importantly, the state's radon database showed a nearly 40% increase in homes being tested for radon that month compared to the previous month. This marked the first increase in New Jersey radon testing rates in 3 years. Another example I'd like to share is from our recipient, Oregon, where test results showed high levels of lead in drinking water at some schools. Oregon Tracking worked with partners to develop an interactive, searchable map that provides public access to schools' drinking water test results. They also developed a video demonstrating how to use the map, information for school administrators and parents on lead in school drinking water, and other resources to help reduce children's exposure to lead and other harmful contaminants in schools. The final example that I want to share is from our city recipient, New York City, where every fall the city sees a large increase in hospital stays and emergency department visits for asthma, especially among children. Possible reasons include infections among children returning to school, seasonal pollen, and cooler weather. So the New York City tracking program analyzed childhood asthma data and used the results to write messages for healthcare providers. The messages urged providers to update patients' asthma management plans in time for the school year start. In the past few years, those seasonal fall mailings to healthcare providers and other asthma prevention activities have coincided with a decrease in rates of New York City hospital stays among children. Because of the program's success, advisories to healthcare providers have become a standard practice at the beginning of each school year in New York City. So again, I hope that you do visit the tracking website to read even more success stories and examples of what our recipients have done with their tracking data. The next slide shows a snapshot of the tracking network and the important parts of it, including the Data Explorer, information by location, downloadable data sets, and the application program interface. These are all very important parts of the big picture website availability. I hope that you do visit the link there. You can see it at the bottom. Visit it at your earliest convenience, again, to visit the network and learn all about it. I want to just quickly describe the different sources of data that go into the tracking system. As I mentioned earlier, it's got a lot of data. So remember, it's hosted by CDC, but it includes data from numerous sources that you can see here. You can see the different data sources, including some from within CDC, where we get information from ADAM, or the Autism and the Developmental Disabilities Monitoring Network. We get data from VRFSS and NHANES and the others that are listed there. So we do get data internally or from other CDC partners or teams. We also have other governmental agencies providing data for tracking, including the Census Bureau, Department of Education, EPA, and these others that you see listed there. We have, again, the numerous state and city health departments that we fund. We receive a lot of very valuable data from them, including birth defect data, data about their childhood lead poisonings, drinking water, and emergency department visits, and hospitalization reports. And as you can see there in green, there are also numerous other data sources that we depend on, including poison control centers and reports from national radon testing labs. So I really just use this to highlight that tracking is a nationwide network of data available for all of us to use. So now I'm going to turn it over to Holly, and she is going to take us into the network and show you exactly how it can be used. Holly?
My screen over to the tracking network, and hopefully everyone is seeing that now instead of slides. Anne gave a preview of it in the slide sets, but here it is live. I'm gonna try to scroll a little slower through here. I'm not sure if there's just a wee bit of a lag from using through Zoom. So let's just take a look around the Environmental Public Health Tracking Network. Here is the landing page, and that's where you can get to all of the tools that Anne had mentioned during her discussion. But I wanted to first start with letting you know that we do have data, and that's primarily what we focus on, but we do also have some contextual information about our different topics where you can get a little info about the topic and why it's included in the tracking network. Sometimes it's obvious it's an environmental hazard, or the links between, or the potential links between a health effect and the environment make a lot of sense, or they're kind of well known or at least heard of before, and some of them might be new or different, but you can see here the different topics in the environmental category, and you can click on one of those and you're taken to some information about the content area and also a little information about the data. So we have one for, this is our environments. We also have one with our health effects, and you can browse through there, and there's links to information, and then there's also links to just jump straight to the data if that's your goal for visiting the tracking network. Also on our landing page, I wanted to point out that if you are interested in learning more about the state and local tracking programs, what they're doing, what kinds of data they have, you can get to them by clicking on the state and local tracking programs link. And you can, here's the map, that should look familiar to you. And if you scroll down, you can get links to a profile for our states. If you click on that, you can see here's a link to their website, a contact info, and then just some quick information about the individual state or local program, if they have some unique data. One of the nice things about tracking is that we are all working together on the same topics. We work very hard to standardize data from a lot of different sources so that they can be easily compared across geography and time. But we also, understanding that public health and environmental health is very local and can be different just by crossing a street or by crossing the country. The issues may be different. So our state and local tracking programs that we fund also have the ability to incorporate data sources or types of data content that are of importance to them that may not be relevant to other states or at a national level, but again, they follow the same sort of data standardization rules and display recommendations that we've come up with as a program, and they're very much in line with the mission of the program, but they're personalized and relevant to their populations and jurisdictions. So that's our state and local programs. And one tool that I think would be a good first stopping point for folks who either are not super data savvy or not interested in it, or maybe you just are really strapped for time, or if you need something really quick and easy that you can share with people that you're working with whether that's people working in nonprofits or someone at a local health department, if you're at a state health department, or maybe something you want to share with parents or school administrators, then this info by location is a great place to start with for that. Info by location pulls data from our gigantic database of nearly 500 measures that Anne mentioned during her presentation, and presents that same data, a selection of that same data, let me say that, in more of an infographic visual presentation as compared to the Data Explorer, which we'll get to later on. And how this works is you can enter a county name and it will prompt you, did you mean DeKalb, Georgia? And I did, but I also want to show you that you can enter in a zip code and it will also offer some suggestions for you. So I'm going to look at DeKalb County, Georgia, which is where CDC is located. And I'm going to hit submit, and it will think for a few seconds so it can pull that data from our database, and it presents information, as I mentioned, in more of a graphical format. And every query will start out with information about the county that you have requested information for. Some of you may be selecting information for your own county, or maybe it's a neighboring county or some place you've never even been or heard of before. So this just gives you an orientation to where it is in the state, some quick demographics about the populations there and the makeup of the populations. At the end of each of these segments, there's an opportunity for you to discover the data, which if you click on that, that will take you to the Data Explorer, so you can get more into the weeds with the data. Or if you want to learn more about the topic, it will take you to those content pages that I started out showing you. And if you would like to, you can also share these through social media. Facebook or Twitter are the options right now. And so if you just scroll down, you'll see the next section is asthma, and it gives you a little bit of information about the topic and then provides the data off to the side. For this one, we have adults first and then children, and then a comparison of Georgia with the national rate, so you can get a sense of what that number means. Is it good? Is it bad? Is it average? Is it way beyond? And are we doing great? And then I'll just show you a couple more of these. So this is air quality, and this is the number of days that residents were exposed to unhealthy levels of ozone. And the most up-to-date data are supplied in info by location. As I mentioned, it's pulled directly from our database. So anytime we update data, this info by location is showing the most current data at any time. I'll just show you a few more of these. These are extreme heat, heart attacks, access to parks, proximity to highways. And then at the very end, it has a way for you to share this information through a link, and links you back to our social media and to the Tracking Network webpage. If you had selected a state that is one of our funded programs, then you would also get a link to that program. Georgia is not one of the funded sites, and so that's not here. But if we had chosen one of the states that are part of the program, then you would have seen that. So that is info by location. And next, let's jump over to the Data Explorer. This is the thing that we've been talking about and plugging for a while, and now you get to see it in action. So when you say I'd like to look at some data, then this is the panel screen that will come up, and you'll see that it guides you step by step of what you're supposed to do, and it won't let you jump ahead. It won't let you skip a step. You have to do them in order, and then then you'll be able to make the next few choices. So you always start with your content area, and all of them are listed here in alphabetical order. So if you know exactly what you're wanting to look at, you can move quickly, or if you're just not really sure what all's in there, you can just scroll around. So I thought we would look at our climate change data. And these data are data that we have gotten from various sources, and we work very closely with CDC's Climate and Health Program. They are in our same group, within the National Center for Environmental Health. We work very closely with them to make decisions about which kind of climate related data to show, how to show it, and that kind of thing. We have a very close partnership. So if you have seen presentations from the Climate and Health Program during different times of the SOFI conference this year, they're one of our one of our big partners internally to CDC. And when you click the next option here, which says choose your indicator, these are all the different types of data that we have under climate change. And they're also listed alphabetically. And you see there's anything from flood vulnerability, extreme heat, extreme precipitation, and we have also included health effects related to exposure to extreme heat. And then in addition to that, characteristics that may make certain populations more vulnerable to adverse effects from extreme heat exposure. So I thought let's take a look at historical extreme heat days and events. And I'm going to choose number of extreme heat days for the content. For geography type, whatever options are available will be listed there. Some content have more limited geography selections, and some will have more. It really just depends on the kind of data that we're able to get. So I would like for us to take a look at state by census tract. We're really proud of the amount of data that we're allowed to pull in at census tract level. For those of you who don't know, census tract is smaller than a county level, usually. It's based on population, and it's what census uses. That's why it's called the census tract. And it gives you a better sense of what's going on, because if you have worked with a county, or if you've worked at a state level, or looked at statewide data and tried to compare it to your city or to your county, sometimes you might find that it's not super reflective of your particular neighborhood or community. So we are trying through the tracking program to bring more local level data to folks so that they can make more tailored, informed decisions for their community. So I'm going to pick Georgia again. And for our time frame, we have, if you scroll down, you'll see that it goes all the way back to 1979 for the data available. I'm just going to pick a few, just pick the last most 5 recent years. Some of our data here will have advanced options and some of them don't. They're set up at default with the setup that we think would be most helpful for the most amount of people. So I'm just going to go with the default measurements here that are provided, but it's certainly, if we wanted to, we could mess around with those and customize our data output for our needs. And then you press the go button and it'll take you to an output. Usually the first thing that you're going to see is a map, unless for some reason there are a couple of content areas that don't have a map view, and they will put you in a table view. So here we are. Here is Georgia, and you can see that where it is kind of in relation to everybody else. If you just mouse over the map, you will see the county name and its census tract number off to the side there. And then in the white area there will be the number for the value of whatever it is that you've looked for. So we were looking for number of extreme heat days, and this one, the number of days was 43, and this was in 2016. And you can just kind of move the mouse around and see what some of the other numbers were. If you look over at the legend, you can see that the darker the color, the more days there were. The way these maps work is very similar to how you would navigate through a Google map. You can pan around, and you can use these plus and minus buttons off to the side to zoom in and zoom out. We also have a nifty feature that's fairly new where you can click on the magnifying glass and type in a zip code or an address, and I'll just put in DeKalb County again, and I'll say yes, and it'll drop a marker where that location is on the map, which is really handy if you're trying to stay oriented to a particular place. Also, on our map feature, I like to show you this particular area here. This will show you if you chose multiple years like we did, you can click that and change the map to a different year. So we can look at 2015, and we can look all the way back to 2012 and see how that looks, and see that it looks quite different over the years. There is a way, if you choose multiple years, to view them in an animated way so you can watch how things change over time. And you would click this looks like a play button, and mine is not working today. It wasn't working for me yesterday. It was working for others, so I'm not sure what's up with that. But if you try it out, then what should happen is that the map will change and scroll through each of the years. And all the while that's happening, you can still zoom in, zoom out, you can mouse over, you can leave your cursor at a certain place and see how the numbers change over the years. It's a really interesting and effective way to see how things change over time. I'd also like to show you over here, this gear shift icon. If you click that, it says, if you hover over it, it'll say map options. And this is a way for you to add some interesting layers over top of your map. Let's say you're interested in knowing the location of any of these places. So we're talking about extreme heat days. And so it might be interesting for us to know where nursing homes are located. So you press nursing homes, and if you close out or if you click away, you'll see that now the map is populated with a bunch of polka dots, and we have a caution sign over here. That's just telling you that we're not showing you every single spot. You need to zoom in to see more individual locations. So if we do that, you can see that each dot actually is a location and it should provide you with the name of the facility and the address. If you also want to look at another type of overlay that might be of interest to you, you can go over to select overlay layer, and currently we have surface smoke. And these are all near real time. There's a slight delay, but for the most part, we consider it real time. You can look at surface smoke, you can look at transportation noise, cyclones, and I'm going to choose current weather radar. And we're still zoomed in here, so I'll zoom out and you can see what's going on weather-wise. We've got some big storm heading our way, it looks like, in the next few hours. So those are two of the interesting layers that you can see. This would be something good to know. Let's say if you were looking at number of houses that are located in a flood zone, which are data that we get from our friends at FEMA. I also want to tell you that you can view the information in a chart, and you can sort by however you like. You can zoom in you can space out things, you can make some adjustments to the chart. If you've got multiple years, you can also do some different chart options and change it from a bar chart to a trend chart, or we can look at a trend chart over time. And it will prompt you of what you need to do. We'll take all those years and we'll say that looks good, advanced options. Is it going to let me do it today? Maybe not. Oop, and we might be stuck a little bit. But I see I'm getting close to the end of my time, and I wanted to show you some other things. Let me X out of this and see if I can get back to it, or if we're just totally hung up. Here we go. I think maybe working through the Zoom has made it a little bit sluggish. So I'm just going to really quickly get back to where we were and show you some more features. Georgia in a couple of years. And just press go on that. Okay, here we are. And let me show you that you can also do a table view. Most importantly is that these data are shareable and downloadable. So if you want to grab all these data and do some of your own analyses, you are welcome to do that. And how you would do that is this down arrow here. It says export, and it will export all your data into a zip file in a CSV format, which is like an Excel spreadsheet. And then you can put that into whatever program that you like to do. Or if you just want to share it with someone, hey, coworker, hey, classmate, then you would click on the share button, and it gives you a unique URL. So when a person clicks on that, it will load the Data Explorer and the query, and you'll watch it kind of automatically do what I just did, and then end up with the output. And let's say, for instance, if you sent this link, and then within the time that passes between when you sent it to your friend and that person opened it up, we've made some changes or updates to the data. Your friend will see the most updated version because this link is pulling directly from our database. It's not a static image or a static report that you've developed at one point in time. And then that is the super fastest whirlwind tour of the Data Explorer. You can also, if you wanted to, you can have another query going here on the other side. You can go back to the Data Explorer homepage sort of here and pull up another content area and have it displayed side by side. And you can make comparisons between the same topic. It could be two completely different topics. It could be something you're interested in looking at, something side by side, or it might just be something that you're just curious about. So this is heat-related mortality. This is deaths from extreme heat in 2016. You can see here's Georgia. There were 10 counts in 2016. And then you could compare that over here with extreme heat days. I can go back to the map here. Another cool thing is that you can link maps. So it will zoom in on, so whatever you're doing on one side will happen on the other side. I'm just kind of moving the cursor around, and I can look at county level data on the left and then state level data on the right. If there were county level data in there, then it would be showing up the same, and whatever you do to one side will happen to the other. So I'm zooming in just a little bit, and you see that they're related. And the last thing that I wanted to let you know is that if you were interested in seeing our downloadable data sets, those are right here. If you are to the level where you want to pull in data and create your own software display, or if you need it for some more high-powered computing, you can do that with our API, and you can go to the Tracking API help page to get information about how to do that. And I think what I'll do is head back to the homepage here and then stop for some questions, or Anne, if you had anything that you saw that I didn't cover and you think it's something that the people would want to see, then let me know that too.
Holly, this is Anne. I didn't have anything else to mention. I think you covered all the highlights.
Okay, great, thanks.
So we have 10 minutes left, and it's time for our question and answer portion of the program. One of the questions is, why are there only 25 states contributing their data instead of all 50 states?
So this is Holly, and we have certain amount of money that we are appropriated for our tracking program, and we are able to fund, at this point with the level of funding that we have, we're able to fund those 26 sites. It's a competitive process, so health departments or whoever is interested in applying who meet the criteria, we're only able to fund that many at this time. That's why we try to find other ways to engage with states that might not be fully funded or directly funded by us. So we work through partners like ASTO to help build capacity from with states who aren't directly funded. And just kind of side note, we do get data from some states that are not one of our funded programs. An example is Pennsylvania. They used to be part of the tracking program, but are no longer. We've also gotten data from North Carolina, who is not a funded program. Also West Virginia, who they've all participated in our ASTO fellowship and have built up a certain level of capacity so they're able to share data with us. So you do not need to be a funded program in order to share your data or to submit your data to us. We're happy to work with anyone who's interested in having a dynamic way to display some of their environmental health data.
Great. Our next question is, how do you recommend organizations use this data if they are starting work on climate change?
Oh, that's a great question. I think there are ways that you can look at your current, like a historical and current situations, using some of the historical data on extreme heat days and also extreme precipitation days. And you can look at some of the data that the climate change program has worked with us on is future projections to give you a sense of if things kind of stay the same or if emissions and other sort of protective measures are taken, how the picture might change. I think those are great ways to give you an idea of what's been happening and what could potentially happen in your area that can help with some messaging for sure. And then if there are ways, if you are in one of our tracking programs, some of our state tracking programs have been working with their climate and health programs or just on their own to map things like cooling centers or other, I want to say like facilities or resources that could help mitigate climate change health effects or environmental effects. Those are just a couple of ideas off the top of my head.
And this is Anne. I would also say, definitely to look around in the website because there are a lot of success stories, as I was mentioning. And then you can also link to each funded state or city. They have their own page within our larger, website. And so you can, just really look around. I mean, it's quite easy to get lost in there, just, reading about what different states have done. And, you can find things for almost any issue, including, heat or related topics, and just to really read the stories of what they've done and what's happened. And they have a lot of great information there on our website as well.
That's a great suggestion, Anne. And that reminded me of a project that we've got in the works right now with our climate health program. And it's developing a dashboard that is specifically related to extreme heat. And it's designed with the idea that emergency planners or other people who work in public health would be able to look at a variety of factors to see, to get a better sense of how their community is doing in terms of extreme heat, what they might be able to, all kinds of information that they would need in order to make certain decisions about whether it's opening cooling centers or providing other kinds of services or products or whatever it might be to their constituents. We're hoping that that's going to be ready for prime time sometime in May. As far as the last I heard, we are still on track for that release date. We're really hoping to have it ready before summer takes off and heat becomes much more of an issue for folks.
Great, thank you. And one of the participants would like you to please repeat the downloading data and getting help on the site.
Repeat how to do downloadable data sets?
How to download the data, and if they have any questions about getting help on the site.
Yeah, okay, that's great. So if you are interested in a complete data set, we have a few of those that you can just download the whole thing, not everyone. But if you're, let's say, let me go back here. If you want to download these data right here, you would click on the down arrow, that's an export, and just click on it and it'll prompt you to whatever steps you need to take. Where do you want to save it? And that's how that works. And let me go over here to our PowerPoint slides that has our info at the end. So if you are having questions, or if you just want to stay in touch and learn about when we release new data or new nifty things like the heat dashboard, this is how you can get in touch with us. If you need some help, I'll scroll up to that. Tracking support at cdc.gov is a great place to send questions if you find that you are not able to do what you think you should be able to do in the Data Explorer. That is a great place. We monitor that mailbox daily. It might take us about a day to get back with you, and but we always will. And it would be really helpful if you could send us the link to what you're trying to query or where you're having problems. And you can do that by going to that share icon that look like a line with two little dots on the end, like a little right-facing triangle doodad. So tracking support is where you can get some technical assistance from us. And then if you, here again is my email and Anne's email if you have additional questions, or also our social media if you'd like to just keep in touch.
Great. And then also there was another comment about how many states in the upper Midwest are not representative and they have large Native American populations and reservations. How would you go about collecting data in these hard to reach populations?
So we have been working with several tribal groups over the last few years, and the Great Lakes Tribal Epi Consortium around that Midwest area has been a partner that we've been trying to work with to get better data about environmental health issues in tribal lands, tribal areas in Indian country. We've also been working with some of the groups out west to do the same types of things. It's been a very slow process, but it's one that we're interested in trying to maintain and to get better data for those areas. It's something we realized would be really important, and we've gotten interest from those groups, and we're hoping to try to expand those efforts as much as we can.
Thank you for answering. So that brings us to the end of the Q&A portion and also the end of our presentation. Thank you to our speakers, Holly and Anne, and thank you all for joining us.